Hi everybody, Dr. Tuck here with Tuck Pulmonary. First of all, let me just acknowledge the obvious. I have a mustache. I discovered that I could grow a mustache during the COVID era. It was because 8 months into this thing, I realized it didn't matter if I was shaving or not. And voila, this is what happened. So our video is not what's typical from us, although I don't know if I have a big enough library to have typical videos. What I want to talk about today is how to have church services in the COVID era. Just want to acknowledge right off the bat that these are my personal opinions and are very reflective of the current time and place, which is February 16th here in southern Wisconsin. I should say February 16th, 2021, because who knows how long this is going to go on. I also want to say that this video does not necessarily reflect the opinions of my employer or the leadership at my local church. So what I'm going to do is I'm going to go through a set of assumptions just to let you know where I'm coming from. And then I'm going to talk about my observation of what I'm seeing in folks to respond to COVID, especially as it pertains to church functions. And then I'm just going to go over what our church is doing, not because I think we're special, but just because it's worked out okay. So I'll talk more about those in turn. Okay, so first I'm just going to go through a set of assumptions, just a perspective from where this video is coming from. First of all, I'm assuming that churches should be meeting. Christians have been meeting together from the book of Exodus to the book of Revelation. Man was not meant to live alone. We were meant to live in fellowship with one another, worshiping God. So it's normal for churches to meet. You can clearly, I think everyone can imagine exceptions to that. In the case of like a natural disaster, tornado, hurricane, 2 feet of snow here, late Saturday night, something like that. You can imagine that churches would not meet in those situations, and I don't think anybody would frown at that. You can also imagine times where resources are so scarce that the church simply can't meet together. They don't have a space at all, or they lack the resources to even organize a congregation. Again, not ideal, but understandable. In times of heavy persecution, it's understandable that churches would have trouble meeting together, although I do note that there are plenty of churches in plenty of places in the world that meet at great pains and at great risk to themselves. So those are reasons why why churches might legitimately forego the assembling together. But I am going to contend in this video that I don't think the current situation rises to that level. Second assumption I'm making is that COVID is a huge deal. Hopefully you're making that same assumption. COVID has killed over 450,000 Americans. I suspect that the excess deaths from this are going to rival or surpass the Spanish flu if they haven't already. It's a huge deal. The third assumption I'm assuming is that there may be some good things on the horizon, and there are some definitely good things, or I should say less bad things that have occurred during this. First of all, it's not affecting kids nearly as much as it is older adults. I think everybody could agree that if this pandemic was affecting young children with the morbidity and mortality that it is elderly people, this would just be orders of magnitude worse than it is. Secondly, I think I'm cautiously optimistic that things are going to be improving significantly over the next several months. I'm going to put up a few graphs here. First, you have the incidence of COVID infections in the United States. And then I'm going to put a graph of the incidence of COVID infections in Wisconsin. And then the last graphic I'll put up is a depiction of the incidence of COVID diagnoses here in Dane County where I am. So as you can see, in all of these, the trend is that the total cases are going down. Presumably that's going to translate into less people on hospitals, and less people in intensive care units, and God willing, less people dying. So this applies mostly to the, especially to the here and now in Wisconsin. You'll see in the Dane County graph, things look a little flat and not going down quite as rapidly as they are in other places. Hopefully that's just an anomaly. The next assumption I'm making here is that this applies to the here and now. It's February 16th here in southern Wisconsin. Your situation might be different. The last thing I'm going to acknowledge and put forth here is that some of these recommendations might be out of step with what the current official recommendations are from the CDC or the World Health Organization or your local health department. And it's important for you to be aware of what those current recommendations are and take what I'm advising here in light of those things. Okay, the next thing I want to talk about is just the typical responses I'm seeing from Christians and from churches during the COVID pandemic here. And again, we're almost a year into this. And there's a lot of overlap between these things. So the first group of people, there are folks who are legitimately scared of COVID itself. They are inherently fearful of death or morbidity from getting the COVID virus. And it's understandable why those folks would want to limit their exposure. So some of this fear is warranted. For instance, if you have generally poor health, if you are significantly overweight, especially if you are older, and I'd say over age 60, maybe even over age 50, then it seems reasonable for you to have an inherent fear of getting infected with the COVID virus. It also seems reasonable that you'd be fearful of potentially infecting someone like that if you have frequent contact with somebody with risk factors for a bad outcome from COVID. However, some of these fears are not warranted. If you're young, you're otherwise healthy, and you don't have frequent contact with those that are at increased risk, or if those folks that you do have frequent contact with have some measure of protection either from prior infection or, more importantly, vaccination, then I think you should be happily going to church without being fearful at all. If you're young and healthy, COVID essentially offers you almost no risk for mortality. That is, no risk for you to die from it. It's not absolutely zero, but it's pretty close. Sometimes you might move back and forth between these groups, or in and out of this group, where sometimes you are inherently fearful and sometimes you're not. And sometimes that might be situational. For instance, if you're going to go see an aged relative in 2 weeks, it seems reasonable that you want to be much more cautious during those 2 weeks leading up to that visit. Let me just draw your attention with another graphic here that I got from the Dane County website. Our local experience here has been that age seems to be the biggest risk factor for a bad outcome from COVID. If you see here, when I accessed this in February, if you're over 90 years old, you have over a fifth, I should say over 20% chance of dying if you get infected with COVID. That's a huge number. It does drop as the age goes down, but it's still significant. If you're between 80 and 90, it's 13.7%. If you're between 70 and 79, it's 4.5%. If you're between 60 and 69, it's 0.9%. If you're between 50 and 59, it's 0.3%, according to these numbers. I'll leave a link to the website here below so you can see what the current numbers are. So if you're less than 50 and in Dane County, the chances of you dying of COVID if you get infected are minuscule. It's not zero. There have been a handful of people that have died who are under age 50, but it's not even enough to register a tenth of a percentage at this point. So when you're doing your own internal risk calculations, keep this data in mind, but also keep in mind that if you're in your 90s, you might want to roll the dice. I don't know how I'm going to feel when I'm 90, but it might be that if I'm 93 years old, I might be telling myself, you know what, I don't want to just not go to church for a year. I don't know how much time I have left. Church is good. I want to see my friends there. And if people want to take those personal risks, I think we leave that up to them. Although I do recommend those people are aggressive with other things like mask use. We'll get to that later. So that's the first group of people who are inherently fearful of COVID itself, either for themselves or of others. Secondly, there's a group of people, and there's significant overlap here. These are folks that are not so much scared of COVID itself, they're scared of what people are going to think of them. They're scared that their neighbors are going to think that they're some sort of science deniers, or that they're just selfish and they don't care about other people. And I have to be honest, you might be right to be fearful of that. Having a good public reputation is important in the New Testament. The New Testament talks explicitly about that, but you can't live your life based wholly on unfair interpretations of your words and deeds. If your neighbors have an unjust opinion of what your motivations are in moving or in going to church, then it's important to try to help them understand where you're coming from, but also it's more important to have your neighbors think ill of you than to disobey God. So I've heard the saying, it's better to be with Jesus in the desert than with Pharaoh in the palace, and that's true. Yes, what your neighbors think of you is incredibly important, but it shouldn't be the thermostat for the temperature of your lives or how you live your life. The third group of Christians I see are those that want to meet with absolutely no precautions. As you can probably guess, I disagree with these folks strongly. You can understand why your neighbors might think poorly of these guys if they exhibit too much bravado or kind of a deliberate ignorance. But that's not all of these people. This is not a homogenous group. A lot of these folks are not deliberately ignoring the reality of COVID, the seriousness of it. But I think there's a general disposition or an emotional state where they're looking out and they're seeing what has clearly been a ham-fisted, sometimes arbitrary, sometimes heavy-handed I would say overall incompetent response from many, if not most of our public government leaders and public health officials. There's been a lot of flip-flopping that has not made sense, especially with regard to mask use. There's been a lot of arbitrary rules where some groups are allowed to meet or some activities are allowed to go forward and some aren't, and there's seemingly no rhyme and reason. So yeah, I understand why people might be so tempted to want to just ignore anything that health officials are saying or that government leaders are saying. But at the end of the day, this seems like an issue where you would just be cutting off your nose to spite your face. That is, I think there's real reasons to take reasonable precautions in order to meet together, and I don't think you're necessarily kowtowing to the state or violating your allegiance to Christ or just some bizarre things I've heard out of some churches. So those are Christians that think we should meet and have absolutely no precautions. And the last group, that's the group I'm at, I think we should be meeting, but I think we should be taking precautions. I think it's unreasonable, if not downright sinful, to just abandon the gathering of the church. It's very understandable why some people aren't going to be able to make it, but in this day of technology with relatively cheap and easy options for streaming services or YouTube playlists, there's no reason not to have a meeting where most people can come with precautions and leave the folks that are high risk either at home or be extra cautious during the assembly. So again, that doesn't mean that some people should come no matter what the risk is to themselves or others, but it does mean that there should be church meetings almost without exception. If you're a church and almost everybody there is over 70, then yeah, it seems reasonable that maybe everything should be virtual or online, but even in that case, I think there's going to be a handful of people that want to come and meet in person. And if there's only a handful of people, you can space out really well. So that's the last group of people that think that we should meet, but with precautions. In the next section, I'm going to talk about what our experience has been at our church, just because it's working out fairly well so far. Okay, so this last section, I'm going to talk about what our church experience has been, not because it's necessarily completely right, but it just seems to be working out okay so far, with no cases directly attributed to meeting together, and that's since I think April or May we started meeting together again in person. And also, although we obviously have a lot of people that have a lot of different opinions, I don't think there's been serious heartburn, although I'm not an elder right now, so I'm not getting the bulk of the complaints, I have to say. So these are things that our church has been doing, and again, we've been meeting together at least since April. We met outside once the weather got nice. That worked out very well. We never had to cancel because of weather, and it was just kind of a dry summer. But then we moved inside, and we've been using precautions. And again, no cases directly attributed to meeting together, as far as I know, and I've been paying attention. So first of all, churches should acknowledge that meeting together is a risk for COVID. Close contacts spread COVID. There's absolutely no doubt about that. I think it's going to turn out that close contacts are the most important way that COVID is spread. So meeting together, by definition, increases the chances of somebody getting COVID. If you're sitting directly in front of somebody and they are coughing their head off and they have COVID, your chances of getting COVID have gone up tremendously compared to if you had just stayed at home and watched TV, which you shouldn't do. So your chances of getting COVID increase by going to church. I don't think there's any reason for us to deny that. So that's one thing for sure. Just acknowledge the risk. I think it's important. Don't deny that there's a risk there. Just say that meeting together is important and it's worth the risk. Secondly, we've been providing flexibility. So starting out, what we would do is our pastor would record a sermon, and then we would put together a YouTube playlist with lyrics, and some of those videos were better than others, and people were generally watching those at home, and we're still offering something like that for people that want to watch at home. I think up until recently, we might not be doing that now, because right now we're just streaming the services. We do have some fairly technically savvy people, but it's not like it's all that we do. It wasn't that hard to set up. We also set up a spillover room so that if our church, our main room is too big, too crowded, people can go to a different room and watch the streamed service. Thirdly, churches should tell people, and put a huge emphasis on this, don't come to church if you're sick, and don't come to church if you've had close contact with somebody with suspected or known COVID. Asymptomatic spread probably isn't as important as it was initially thought that it might be, but symptomatic spread has been shown to be a huge deal with COVID. Don't go to church when you're sick. Don't go to church if somebody in your household might have COVID. For a specific situation, if one of your close contacts has a COVID test that hasn't come back yet, I would consider yourself positive until that comes back. If it comes back negative, as long as you're not sick, I think you should consider yourself negative and again, continue to meet with precautions. But do not come to church if you're sick. Do not come to church if you had close contact with somebody that's sick until you're sure that they don't have COVID, until you're sure that you're not going to get sick from the same thing. Next, this is less obvious, but and I don't know if the benefit is there, but I think churches should shut off their air circulation during the service. So I think 15, 20 minutes before the service starts, you should turn off your air circulation. Kind of depends on how you're heating or cooling your building, but this has been something that's been shown to be a big deal in restaurants with the ducts and the airflow. I don't know if there's a significant role for that in a big room like a church, but we've been doing it. Next, have plenty of hand cleaning stations. I think everybody's agreeable with that. It's easy with Purell and alcohol gels. The shortage, at least here in southern Wisconsin, hasn't lasted. It's been very easy to purchase. Next, consider alternative ways to do the Lord's Supper. This is a little less straightforward because of the meaning and purpose of the Lord's Supper, but we've set up an alternative where people can bring their own elements or take some prepackaged elements before the service, so not as many people are walking around. We are serving the Lord's Supper normally with the server typically masked and gloved, but you might need to consider alternatives to the Lord's Supper. Next, you probably need stripped down ministries. So most of this video is just about our Sunday morning service. That's all we've been really focusing on. There's been a few scattered meetings here and there, but we are not a program-driven church. But even those programs that we have really been pared down, and I can imagine that that's how it would be at your churches too. It just adds to complexity. It's hard enough to try to do this safely as a normal Sunday morning church service. So strip down services, strip down ministries, strip down programs. Next, Christians should weigh their personal risk aversion, their personal risk factors, and the risk aversion and the risk factors of their frequent close contacts. That is, a lot of this is not me or anybody else telling you exactly what you should do, but I do think that's because everybody's risk aversion is a little bit different, and it goes for the close contacts too. So you might have a close contact who's 70 years old or 80 years old, say a parent living with you or somebody that you see frequently, and they might tell you, you know what, I want you going to church. They might tell you that their risk aversion is such that they will not hold it against you at all to meet. So take stock of what your personal risk factors and risk aversions are, as well as those of your close contacts. One caveat with that is that I think Christians are grossly underestimating the benefits of regularly meeting together for worship services, and I think we're also grossly underestimating the damage that total or severe social isolation is causing people. It's not normal not to meet with other people. It's just not. It's not good for us either. Next, churches should recommend effective mask use. Masks have shown to be effective. There's a lot of nonsense going out there on the internet, but whether it's nonsense or whether it's true depends on what you mean by masks and what you mean by effective. So in the pre-COVID experience, there were studies that showed the efficacy of medical or surgical masks to prevent the spread of respiratory viral illnesses in hospitals. There have been studies showing that medical or surgical masks decrease the spread of influenza in households if somebody has the flu. So it's out there. We've had more recent evidence, I would call it micro evidence, so situational evidence on things like airplanes and in like beauty salons, where there's just been very little spread, but also very strict enforcement of masks. The flights are a little bit different because they've got from my understanding, they have a very good, very effective filtration system. That might turn out to be playing the bigger role there. Those are the more recent anecdotal evidences. So masks do work, but they are not 100% effective in any situation, and it depends on what type of masks. So I'll talk more about that in a second, but the other thing I want to say about the language is we're using the language of recommending masks. So our church recommends that people wear masks when they come in. We don't use the term required, and that's on purpose. And we think that's because when you use the term required, it automatically implies or requires, as it were, that you're going to police that. That is, you're going to bar people from entry that aren't wearing effective masks, or you're going to call some authorities to remove them. That just seems completely crazy to me. I mean, honestly, I don't know what else to say. If you're going to physically bar people from not coming in or accost people for not wearing a mask, I'm not sure what else to tell you. That just seems crazy. We don't use the term masks allowed, and I wouldn't even address this except I was at a conference recently and they used that term that masks were allowed. Well, that also seems crazy to me. Of course masks are allowed. You shouldn't even have to say that. To say that implies that masks don't work at all, and it also implies that it's, I don't know, kind of a weakness if you would consider wearing a mask. Recommended seems like good language to me. It takes the compulsion out, and just going with our church experience, we've had like 80 to 90% compliance with mask use without using the term required. So we use the term recommended. Last thing about masks is that they should be effective masks. I think N95 masks are probably the most effective, but those medical or surgical masks are also effective. And the things that you can easily get online, so the masks that are available easily through Amazon, I have found, are like the N95 masks, or those, KN95 masks, or the KN94s. The N95s have been hard to come by, there's no doubt about that. I suspect that these KN95s and KN94s are probably on par with those surgical masks. They might even be a little bit more effective, and that's just based on how I feel with the seal and how it's pulling. I don't have proof for that. I've been buying the KN94s from Amazon, basically because they're from Korea. I suspect Korea has pretty decent standards. One annoyance for me personally has been that the current emergency order in Wisconsin, as far as I can tell, is still recommending against N95s and medical masks because they're implying that there's some sort of shortage. So anyway, I recommend those medical masks or the KN94s or KN95s. If you have access to N95s, then go for it. They're probably the most effective. So I think the last caveat I have about masks is that I think it would be okay for churches to loosen their requirement for three groups of people. First of all, vaccinated people. The vaccines appear to be very effective, and it seems to last. And I don't think we should have to wait to see if they work or not to prevent community spread. I think the evidence is overwhelming that they are going to prevent community spread. As far as people that have been infected with COVID, it is clear that they are less likely to get COVID again. There have been reported cases, but there's not a whole lot. With the coronaviruses that we do know about from the past, it looks like people maintain immunity for at least a year or two. So if you've been previously infected with COVID, I think the benefits of the mask aren't as high as if you haven't been vaccinated or infected. And then lastly, little kids, I just don't, it seems to me like if your age is 10 or under, there's really no reason to put a lot of emphasis on those folks wearing masks. Thank God kids, especially little kids, have not been a significant source of spread. And then the last thing that we're doing that I recommend for you is that you should hold off on the holy kisses, and I'm sure our pastor is happy about that. So make sure to leave a comment, like and subscribe. We'll put some useful links in the show notes, and thanks so much. Bye.